Hello, welcome to another IAPP webcast. I have with me today Dr. Rono, who is from the Ministry of Health in Kenya, and he's very pleased to talk to us today. I'd like to mention that he is an IAPP Eye Health hero, so we're very privileged to have him here. Welcome, Dr. Rono.
Thank you very much.
I'd first of all like to ask you if you can say a few words about yourself and your work.
Thank you very much. As you've heard, my name is Dr. Rono. I'm an ophthalmologist working with the Ministry of Health now for the last 5 years. My interest in ophthalmology began way back when I was in medical school, when we had this medical camp in the rural area in where I currently work. And of all the conditions that we had, respiratory diseases, malaria, we could treat them as medical students. But when somebody came with eye conditions, we could not treat. And actually most of them we referred, we gave them TEO and we referred. And I said, yeah, that's where the problem came in. And that made me to go and study ophthalmology. Now, after I finished my ophthalmology, that's 2006, I requested my chief ophthalmologist to post me to this area, which I had gone before. That was while I was a student, so that I could make a difference in that area. So there, I requested to be posted and chose the station where I wanted to be. And I was happy because he agreed to post me to this hard hardship area where nobody had wanted to go. And when I reached there, the number of surgeries being done were very low. There was no trained, there were basically one nurse who was interested in ophthalmology. And that was where my real challenge in ophthalmology began. And I should say that at that time we were operating only 45 surgeries in a year. We had only one cataract set. And so I went down to work. So when I asked, I want to operate, they showed me a cataract set which was not working. And I discovered that I need to do some work. So I first of all took that nurse for training, and then so many partners started coming to support me. The first partner who came was Operation Eyesight Universal, who built for me an eye unit. And with that, we were able to develop the eye care program. Then Seeing is Believing, Standard Chartered, built for me also another second unit, and Spanish Eye Doctors built a third one. And in that case, I was very happy, and we increased our cataract operations from 45 initially up to around 300 second year. Thank you.
And looking forward now in the next few years, as you said, you work in a remote area and the resources are small, poverty is high. What do you see as the main challenges?
There are quite a number of challenges in that particular area. One of them is that after the eye units had been built, we discovered that we were staying in the eye units ourselves, and the patients were not coming, and us, we were not getting out. So we learned that the problems of these people is actually access. They cannot come to the facility. You have a very good facility, but you have to reach down to them. So the first thing that we have is inequity. People are very poor and they cannot access the services. Number two, they are not aware of the services. And then the diseases that are afflicting them are diseases of poverty, trachoma, in this particular area. And those diseases needs to be prevented rather than being cured, because by the time you think of curing them, you've already lost the battle. So that's the basic challenge that I think we have. The next one that I think we have is we need to still build the infrastructure. We still need to build infrastructure, and we need to still train the human resource, and of course develop strategies that will prevent the diseases and to treat them in a cost-effective way, which is sensitive to the community. Thank you.
And I know that Kenya has been quite successful in terms of, in the Ministry of Health, pushing blindness up the agenda. What do you feel has been one of the key factors in that?
Thank you very much for the question. The key success factor in Kenya is basically the governance. We have a national coordinating body called the National Prevention of Blindness Committee, which meets every quarterly. And in this quarterly meeting, we have all NGO partners together with governments, and we meet and we strategize. I, as a total surgeon from Kitale, do participate in those meetings, and I meet my partners and articulate the problems and the challenges that people face. And in that meeting, then the partners will refocus and say, we are going to support these activities. And we plan together. and we implement together. So eventually I become the implementer, and we continuously evaluate together, and we plan the challenge, and we plan and see, we plan and counteract the challenges that come as time goes by. So in Kenya, governance and coordination is very, very good. And then we have a dedicated staff who are willing to go an extra mile, and they're willing to get out of their office to go to the field. And above all, we have a very good NGO sector, which are well coordinated, and they work together in collaboration with government. There is no parallel system, they are all integrated. Yes. So, and they follow, in this meeting, the government sets the agenda that this is where we want to go, and the NGOs support it. So the government itself leads the way, and then the NGOs provide the financial support.
Thank you very much. And I had another question. I believe this is the first time you've come to one of the IPP General Assemblies. What are you going to take home from this experience?
Yes, thank you very much for the question. Actually, this conference is the first one for me, and I'm going back home with a wealth of experience. First of all, the knowledge, all the qualified and all the international people who are experts in their own field are here, and through the interactions, you are able to get knowledge that you can apply home. Secondly, you have people who are heroes from other parts of the world, people who have been working in other environments. Through the interactions, you are able to get their experiences, share what you are undergoing, what you are experiencing at home, and also get what they're experiencing. And of course, by sharing, you might learn one or two things that you can apply back at home. Thirdly, of course, there is the issue of networking. When you have a whole network, when I'm stuck back at home, I don't have to be stuck. I just need to call somebody, pull out a card and say, I used to know this person. I talk to them and probably I'll be able to get one thing. So this conference or meeting is very important and very crucial. And of course, there are also people who are in policy, and there are people who are at programs, and there are all people who are implementers. And when we meet all of us, we're able to come up with an agenda of workable solutions.
Thank you very much for that. And I'd like to just congratulate you again and wish you every success in your work. And hopefully we'll meet again. Thank you very much.